extension, and I want to do a glide. Okay, so we're going to start at the radiocarpal joint. So if I'm going to glide the radiocarpal joint anteriorly, I need to stabilize the distal radius and ulnar on the anterior side. Okay, I'm going to put this down. Okay, and
Record.
here we go. Okay, so we're going to do keep her in neutral for now, just so you get your hand placements, and you do a teeny little distraction, and then glide the proximal row of carpals anteriorly. And this is going to be all grades 3 and 4. Okay, so a teeny distraction, and then glide in grades 3 or 4. Okay, then as she gains more extension, I can take her into more extension, and notice that I had to move my body to stay parallel to the joint line. A little bit of a distraction, and 3s, 4s. Then I can take her into more distraction, more extension, little distraction, 3s and 4s. Okay? Yeah.
Which hand do you do the glide? Which one hand is stabilized? This the one on the.
Well, if I am gonna do an anterior glide and this hand is doing nothing, then this is what's gonna happen. Okay, so I have to stabilize. If I'm gliding anteriorly, I have to make sure that the stability is here anteriorly. This is my mobilizing hand, because it's going from dorsal to anterior. Okay, so that's the PA. Okay, if I want to increase, now there are other hand holds, I'll show, but I'm going to go the other way now. I'm going to go still at the radiocarpal joint, and I want to increase flexion this time, so I'm doing an AP glide. Okay, so I'm going to stabilize with this hand on the dorsum. Okay, do that little distraction, and I can keep my elbows parallel to each other. That's even better. So teeny bit of a distraction and a posterior glide in 3s or 4s. Then I go into more range as she gets more range. Teeny bit of a distraction. I change my arm position. And I'm going 3s and 4s. And as she gains more range, I change my position into distraction and 3s and 4s. Okay, so that's anterior glide and posterior glide at the radiocarpal joint to increase flexion and extension. Okay,